I am Dr. Vijay Bhaskar, orthopedic surgeon. Today we will discuss about the hip pain. Hip is the formation of acetabulum of pelvis bone and the thigh bone, otherwise we call it as a femur bone, the ball of the femur bone. So these together it forms a hip joint. So the hip joint has a lot of movements in extension, flexion, rotation, abduction, adduction. So these are the various complex movements of the joint is most important in our body, where it bears the weight of about 60% of our total body weight. So the hip joint suffers due to certain arthritis diseases like septic arthritis because of the infection by the bacteria, tuberculosis, TB, likewise. And then there is an immunological disorder like rheumatoid arthritis, psoriatic arthritis, and sometimes gouty arthritis. And then if there is a degenerative osteoarthritis, which where the head of the femur, because of the wear and tear, it gets necrosed. So, and then where there is a possibility of avascular necrosis of the head and neck, that because of the injury to the arteries or the utilization of the steroids or misuse of smokers, there will be damage to the vascular supply. Nutritional blood supply to the head leads to damage to the head, leads to avascular necrosis. And then sometimes you see the dislocation of the hip also takes place. The dislocation from the ball comes out of the socket, could be front or the back. We call it as a posterior and anterior dislocation of hip. And there is a congenital dislocation of hip happens in even the newborn children, where due to congenital disease. So likewise, even there is a fractures of the hip like head, neck and trochanter of the head, neck, trochanter of the femur, which where in old age, like above 45-50 age, where they are suffer from the osteoporosis like diseases like vitamin D, calcium deficiency. So most of the hip pains are to be diagnosed with the X-ray, CT, MRI and necessary whatever blood tests you need for the specific diseases. So once you diagnose with your X-ray, CT, MRI and blood tests, then you should treat accordingly. If there is a avascular necrosis of the head leads to degeneration, that should be treated initially with decompression of the neck and head, so that the new vascular supply can be made to recover. If the stage 1, stage 2 can be treated with decompression therapy, but stage 3, stage 4, where there is the head of the femur is totally damaged, then we may have to do the total hip replacement. And then you see congenital dislocation of hip in children, newborn happens, then we have to do a surgical correction by bridging the acetabulum with the bone. And then if there is a septic arthritis, then that is sepsis or the abscess in the joint should be drained out, and then appropriate antibiotic according to the culture and sensitivity should be treated. And then if there is a tuberculosis hip joint, then TB, ATT, anti-tuberculous treatment to be given along with the rest of the part. Sometimes drain surgery is needed. And then if there is a degenerative osteoarthritis like that, the entire head is worn off, or because of the wear and tear, the head is almost to collapse or it is necrosed, then we have to do total hip replacement in a stage 4. Otherwise, we could manage with the painkillers, physiotherapy, braces and examples. So then in rheumatoid arthritis, where the rheumatoid treatment to be given by steroid therapy and disease modifying drug therapy, painkillers. Along with that, then there's the good physiotherapy to be given, and then patient should be treated accordingly.